So I just wanted to make this video to talk about the upper endoscopy and how that process goes, recovery, preparation, all of that jazz. My appointment was yesterday. You can probably hear my voice is a little hoarse, but they have you check in about 30 minutes early. That's just so that they can get your they call it the holding room, which is just the place that they put your IV in, hook up the pulse ox to your finger, get all your belongings into a patient belongings bag that goes underneath the gurney. They ask you your basic profile. Do you have any medication allergies, any reactions to sedatives or anesthesia, what medications you're currently on. They get your height and your weight. I think that was pretty much everything. Once your IV is placed, mine was placed in my left elbow pit. Once the IV is placed, they go ahead and hook you up to a 1 liter bag of saline. That's just to help the sedative move through the body more freely and also offer some hydration, since you cannot drink up to 3 hours before the procedure. You also cannot eat anything after 12 a.m. the day before. Look at the birds. So you're pretty much gonna have your dinner, a midnight snack, and you cannot eat until your appointment. My appointment was at 4 p.m. but they actually ended up calling me to ask me if I could come earlier because they had a few cancellations and they were trying to get home and out of there early. So they bumped my appointment up. So I ended up checking in, I think it was 2:45. They're gonna ask you 90 times if you have a driver or who your driver is. My hospital gives a piece of paper that just has your name at the top, your driver's name underneath, their relation to you, and then their cell phone number so that they can go ahead and call them as you're waking up so that you can, be taken down in the wheelchair. Because when I tell you, my legs were shaking. After I stood up. I felt fine. I had sat up. They had me hang my legs over the side of the bed. And when I stood up, my legs were like jello. I only stood up just so that I could be moved over to the wheelchair. And then the really nice nurse took me downstairs. We went in the elevator, down 3 stories, rolled me outside to the patient pickup. And on my way I went, they say that you can eat immediately. There's no restrictions. You can resume any medications that you had to stop taking for the procedure, such as blood thinners or anything like that. They did go in and take biopsies of some tissue. It takes 2 weeks to get those results back. If those results come back abnormal, I'll make a video about it. If not, on to the next test. I have a brain MRI, brain stem MRI, and full spine MRI coming up because we are now moving to the workup for MS. My original workup was for median arcuate ligament syndrome, but my velocities ended up not leading them to believe that that was the issue. We're also simultaneously checking for epilepsy because I have been having a lot of muscle spasms, tremors, eye rolls, internal vibrations, pins, needles, tingling, numbness, the works. So this endoscopy was to rule out any digestive issues, obviously in the upper part of the GI system, so esophagus and stomach. Hopefully those biopsies come back clean. That way we can focus on getting all the MS testing done. To talk about the procedure itself. So when they go ahead and roll you into the procedure room, my room had 3 people in it. There was the camera technician, the actual doctor doing the scope, and then the nurse that's monitoring your vitals, keeping you calm if anything happens. So they have you lay on the opposite side that they put the IV in, obviously for comfort reasons. And then they prop the pillow up under your neck as you're laying there to make sure your throat is straight. Because if it's bent, the scope will, I can feel where it poked me right here. It had to have gone a little crooked. But there's one spot that's just, or they biopsied that. I don't even know. But it's sore just right here. Maybe they took a biopsy of my esophagus. I don't know where they took biopsies from. I just know that they took them. So they go ahead, once you're on your side, you're in position, they put the mouth guard. Mine was like a purple piece about this big, and then it had a smaller round circle, and that's what you bite onto, and that's to protect your teeth and your lips from the scope. So this is where I started to kind of go in and out. I do remember one brief couple seconds that I couldn't breathe, and I just remember the nurse rubbing my back and saying, keep trying to breathe through your nose, everything's gonna be fine, and then I went back out. So that was kind of interesting. That little moment's kind of like stuck in my head, and I keep thinking about it over and over again, but it was fine. The procedure really wasn't that bad. And that's it. It's a super easy procedure. Don't be too nervous about it. The more nervous you are, the harder it's gonna be for them to get the scope down, because when you're anxious, that can cause muscle contractions in the area. Try to keep yourself relaxed before you go in there so that your throat muscles aren't all tense, because that's just going to give you a worse sore throat at the end of the procedure. So I hope you guys stay well, and I hope if you're on a journey to a diagnosis that you are getting answers.